All right, there we are. Promoting sexual health, the basics and beyond. We are on Unit 11, sexually transmissible infections and what you must know. So each year, millions of people contract a sexually transmitted infection. Also, sometimes called a sexually transmitted disease, so STI or STD. Or in the past, it was referred to as venereal disease, VD. So the United States is believed to have the highest rate of infection by STIs in the industrialized world. In the fall of 2019, the U.S. Centers for Disease Control and Prevention released the latest report indicating that the U.S. continues to see increasing rates of STIs. In other words, things are getting worse in the U.S. instead of better when it comes to how many people keep getting infected with STIs. So in this chapter, you're going to learn some of the most common infections, why STIs are spread so easily, and how to get tested and talk to a sexual partner about STIs and STI testing. So for genital health, there are a number of potential infections that can be transmitted from an infected sexual partner. Now, they can be caused by a variety of sources, including bacteria, viruses, or parasites. In addition, sometimes genital symptoms are caused by imbalances of organisms, normally present in the genital tract, rather than an actual infection. So indeed, earlier research by Klein and Knopper found that some young people purposefully avoided thinking about STIs and are consequently less likely to discuss safer sex with a partner. There's also quite a few conditions that are not STIs at all, but that people sometimes mistakenly think of as a STI because they affect a person's genital health. So as such, we will consider a range of genital conditions and STI types. So some common conditions include bacterial vaginosis, called BV. Now, this condition is caused by an overgrowth of microorganisms in the vagina. It is the most common vaginal infection among women, 15 to 44. It often results in a foul-smelling discharge that's often easily treated, though some women experience chronic BV. That is difficult to successfully treat. There is not a clear agreement about the extent to which BV is sexually transmitted to or from a partner, so it's best not to think of BV as a STI. Right, because they're letting you know that it is an overgrowth of microorganisms, and you can get that many different ways, right, ladies? Okay, so let's go to the next one. We're going to go to Candidus. In most cases, Candidus is commonly called a yeast infection. It is not transmitted sexually. Candidus is it's very common among women. It's caused by a fungus that's normally present in healthy amounts in the vagina, but becomes imbalanced in the vagina. So pregnancy and taking antibiotics can actually increase the risk of this imbalance. Some research has found that women who are prone to yeast infections, for example, those that get about 4 or more yeast infections in a given year, may be more likely to get a yeast infection if they have frequent cunningings, or if they have intercourse with a man after they have performed oral sex on them. So in both examples, it seems that that the saliva, not sex itself, is what may raise a woman's risk of candidus. And I said yeast infection if they have frequent cunnilingus. I had mispronounced it because I was kind of read ahead. But it's a form of oral sex, in case you didn't follow along with my Rennie Gear. Okay, so, but they're indicating that the saliva is a main factor in increased yeast infections. So keep that in mind. So people who have chronic BV or yeast infections may be best served by meeting with the vulvovaginal specialist. Can't talk tonight. Vulvovaginal specialist. So then you have lice. Let's go into the next one. Commonly called crabs. Pubic lice are about the size of a pinhead. They live and breed in pubic hair. They are spread by contact and cause severe itching. So treatment and cures requires washing with topical lotion and washing the infected clothing and linens. Yep, bugs, crabs, lice. So then there's a non-gonococcal urethritis, and that refers to any inflammation of the urethra not caused by gonorrhea. So it is spread mainly through vaginal intercourse and is common among men. Now, NGU is primarily caused by the bacterial organisms as well as allergic reactions and irritation to substances like cleansers or vaginal secretions, and it is treated and cured with antibiotics. Then you have pelvic inflammatory disease that occurs when the bacteria that causes chlamydia and gonorrhea spread from the cervix upward, infecting the lining of the uterus, the fallopian tubes, and possibly the ovaries. Now, symptoms include interrupted periods, pelvic and lower back pain, nausea, vomiting. So this PID can be treated, but may leave scar tissue, resulting in problems with infertility. Scabies. It is an infestation of tiny mites that burrow under the skin. They are highly contagious and cause redness and intense itching at the site of the infection. Most commonly, between the fingers, buttocks, or under the breasts. A topical lotion containing an insecticide usually kills the mites in one application. So then we have trichomonas, often called trick, which is an infection caused by one cell organism, sometimes present in the bladder, and transmitted through the damp clothing or linens. Trick can cause burning during urination, a foul odor, and a discharge. Men typically have no symptoms, but can transmit an infection. It is treated by oral medication. So there's bacterial and viral STIs. So the U.S. National Center for Health Statistics state that STIs represent 4 of the 5 most frequent reported infectious diseases, primarily due to poor access to health care, abstinence-only sex education, and a less pragmatic approach to sexuality in general. So STI rates in the US far exceed those of every other industrialized country. Some estimates suggest that by the age of 25, 1 in 2 people will acquire a STI. 1 in 2, that's like half, right? When people think of STIs, they more often think about some of the most common STIs, such as chlamydia, gonorrhea, herpes, and others. So chlamydia, the most common bacterial STI in the United States, often asymptomatic, which means there's no symptoms, and if untreated can cause sterility and pelvic inflammatory disease. Wow. If it is transmitted primarily through the vagina, anal, and oral sex contact, it is transmitted primarily through vaginal, anal, and oral sex contact. It is easily treated and cured through the use of certain antibiotics. Now, chlamydia can cause blindness in a newborn through infection during vaginal birth by an infected mother. And this affects women ages 15 to 24, which are at greater risk for contracting chlamydia. Then the next one, gonorrhea, sometimes called the clap, and is the second most common bacterial STI. The CDC reported over 580,000 cases of gonorrhea. So with the expectation that there are significant number of people infected that go unreported, it is transmitted mainly through oral, genital, anal, and anal sexual contact. Men typically tend to experience a pus-like discharge from the penis and burning during urination. Women typically have no symptoms. If left untreated, gonorrhea can cause sterility and PID. If left, remember pelvic inflammatory disease, PID. So if left untreated in men, infection can spread up the genitourinary tract and perhaps involve the prostate, the bladder, the kidneys, and the testes. So it's treated and cured with antibiotics. Drug-resistant strains have been identified and require newer drug regimens for effective treatment. This has made gonorrhea more difficult to cure than in the past. Herpes is more common among women than men. As of 2019, estimates indicate that about 1 in 6 adults overall in the United States. It is caused by one of two viruses, herpes simplex 1 or herpes simplex 2. The most genital infections are HSV 2, herpes simplex 2, and most oral infections are HSV 1. So genital is HSV 2 and oral is HSV 1. So though oral genital transmission is possible, initial outbreaks may include flu-like symptoms, painful blisters or lesions. Later breakouts are often limited to painful blisters around the genitals or anus. And though some have few or no symptoms, medications are available to slow the onset and frequency of outbreaks and treat the outbreaks, but no cure exists. So medications for herpes can also reduce the risk of transmitting it to a partner. So herpes is transmitted primarily through genital or anal and genital oral sexual contact. When sores are present, infectiousness is very high and all contact with lesions should be avoided. A small amount of infection risk is always present, since infectious skin cells may be shed even when no sores are present. Infection can be spread to the eye, through touch, or to a newborn during vaginal birth. So then you have human immunodeficiency virus, HIV, which is the virus that is acquired immunodeficiency syndrome. So human immunodeficiency virus, HIV, or acquired immunodeficiency syndrome, which is AIDS. So HIV gradually destroys a person's immunity against the disease, making routine infections and illness quite serious and life-threatening. HIV is transmitted through blood, semen, vaginal fluid, and breast milk. People can live HIV positive for many years and be fairly healthy. With proper treatment, a person's HIV viral load can be suppressed so much that they would be unlikely to pass HIV to others. This does not mean that their HIV is cured, but it does mean that they can live healthier lives and be very unlikely to transmit HIV to partners. So HIV testing detects antibodies produced by the body and in response to the HIV infection, and so might not catch an accurate diagnosis until at least 3 to 8 weeks after infection. During this window of time, the HIV positive person is infectious to others. To have an AIDS diagnosis, someone must be HIV positive, have a T cell count below 200. A normal range is 500 to 1600 T cells, and or has one or more opportunistic disease associations with AIDS. Some people with AIDS are treated with a combination of drugs that does not cure the disease, but can alleviate the symptoms, delay serious illness, and prolong life. So there are highly effective ways of preventing HIV, including using condoms with an infected partner or one whose HIV status is not known to you, or taking pre-exposure prophylaxis, also known as PrEP. So you have the human papillovirus, HPV, and that affects approximately 50% of adults who acquire HPV at some point during their lifetime. So there are over 100 different types of HPV that causes warts on the hands, feet, or genitals. About half cause genital infections. HPV is a very common STI and sometimes causes bumps on or around the genitals. Now, sometimes HPV does not cause any visible bumps. Some types of HPV have been linked to genital and reproductive cancers, including cervical cancer, and making it very important for females with HPV to get an annual pap test. HPV is spread through oral, vaginal, and anal sex. Shedding of infected cells even during periods of no symptoms, and the presence of infectious cells outside of the area protected by a latex condom, making risk reduction very challenging for HPV prevention. Syphilis. Syphilis is the most common in women among the ages of 20 and 24 and men's 35 to 39. With 115,000 cases reported to the CDC in 2018, a person with a syphilis infection may have a painless canker or sore on their genitals, anus, mouth, or throat. If untreated, the cankers heal during the stage 1, and during stage 2, a rash develops on the hands or soles of the feet, and the internal organ damage and death can occur in stage 3. Treatment at a later stage will not repair organ damage already done by the infection. Antibiotics can treat and cure this infection. Of particular concern is that of 2019 rates of congenital syphilis, meaning that infants who get syphilis from their mother have been increasing year after year. This underscores the need for all pregnant people to get prenatal health care during pregnancy, including STI testing. Viral hepatitis. It is a disease that causes liver damage due to viral infection. The initial symptoms range from mild flu-like symptoms, debilitating illness, jaundice or the yellow look. Chronic hepatitis B and C infections are a risk factor for liver cancer. And there are 3 types of viral hepatitis. Hepatitis A is a spread mostly through oral and anal sexual interactions and contact with feces. It can also be contracted through sharing needles. Hepatitis B, it is relatively infectious virus contracted through infected body fluids. An infected person may have no symptoms and still transmit the virus to others. A vaccine can prevent hepatitis B infection. Now, hepatitis C, it is often asymptomatic and is passed through infected blood, sexual contact, and perinatally. Treatment can slow the progress of the disease, which otherwise causes liver damage and death. So STIs, which can be treated and or cured. So STIs can be categorized in a few different ways. So there are those that can be treated and cured. Some of those are caused by the bacterial infection, and that includes chlamydia, gonorrhea, non-gonococcal urethritis, NGU, pelvic inflammatory disease, PID, and syphilis. So again, chlamydia, gonorrhea, non-gonococcal urethritis, pelvic inflammatory disease, or syphilis. So while these STIs can be treated and cured relatively easy with certain antibiotics, if they are left untreated, some may be very serious. Untreated gonorrhea or chlamydia can cause sterility. Untreated syphilis can cause serious organ damage and even death. So in addition, antibiotic resistance has created situations in which some strains of gonorrhea are not easily cured by antibiotics. As you may know, antibiotic resistance is a serious issue in which antibiotics stop being effective for certain infections, including infections that have nothing to do with sex. Now, some sexually transmitted conditions that are acquired and can be treated and cured, they include the lice, the scabies, and trichomonas. Now, other STIs can be treated but not cured. Key to remember, not cured. And they are caused by viruses. They are typically diagnosed through blood tests and include herpes, human immunodeficiency virus known as HIV, human papillomavirus, or viral hepatitis. So it can be difficult for women and men to face the fact that they may have acquired an STI that they will live with. So in some form or another, the rest of their lives, that it is, unless scientists are one day able to invent cures for the STIs. For the time being, people who are infected with STIs such as herpes, HIV, HPV, or some type of hepatitis need to learn how to manage their condition. So STI screening. So very often STIs have no symptoms. This is one reason that STIs are referred to as a silent epidemic. Another reason for this term is that talking about STIs is often taboo. As such, people rarely talk about to each other openly about having had STIs. Now, when symptoms of STIs do occur, they can include unusual discharge from the penis or vagina, pain during intercourse, burning during urination, painless sore on or near genitals, anus, mouth, or breasts, genital itching, painful blisters on or near the genitals, fatigue and irritability, nausea or loss of appetite, and muscle ache, headache, or joint pain. Now, STIs are diagnosed in a variety of ways. Most require lab cultures or blood tests. Now, some STIs can now be screened for at home with an over-the-counter kit or may require a saliva or urine sample. Most often, an STI diagnosis requires an exam by a clinician, such as a doctor or nurse. STI screening can be provided confidentially, and sometimes HIV testing can be provided anonymously so that you never connect your actual identity with the testing process. This can be important for those who especially value having privacy around this matter. So testing is not painful. Don't let fear of the screenings or results dissuade you from knowing your status. Testing is itself an important risk reduction behavior. Now, some couples or sex partners get tested together as a way to support each other. And this is an important part of the relationship. By talking openly about STI testing and maintaining a non-judgmental attitude about STIs, you can help to reassure other people that you are a safe person, to discuss their most personal questions with. Given how common STIs are, most sexual health professionals meet quite a few individuals who have had one or more STIs who could benefit from someone caring and reassuring with whom to speak. So we are on reasons for engaging in risky sexual behavior. So although there's a widespread of awareness of STIs, many people, even if they know the risk, continue to engage in risky sexual behavior, which increases their chances of becoming infected. Researchers have identified several factors that help to explain the risky sexual behavior of young people. So first of all, perceived low risk of infection. Many people underestimate the risk of contracting HIV. When a person feels like they're low at risk, they may be less likely to use a condom or even talk about the STI testing with a partner. 2, negative attitudes towards condoms. There are many reasons people have negative attitudes toward condom use. Some people are embarrassed to purchase them. Others find the act of putting the condoms on interrupts the sexual mood. And many men complain that condoms decrease the sensation, making sex less pleasurable. But until these barriers to condom use are overcome, it will be difficult to decrease STI rates. 3, myth of personal invulnerability. Even if they are somewhat informed about a risk of infection, some people believe they are somehow immune to HIV, AIDS, or STIs. I ain't worried about that. I can't get that type of mindset. Younger people in particular seem to have "it won't happen to me" mentality that leads to a greater willingness to take risks. Unfortunate, right? And another factor, gender and power. Many women in particular who want to use condoms but feel unable to assert their wishes to a male sexual partner. Some women carry female condoms with them so that if a male partner refuses to use a penile condom, they can say, "That's fine. I have a female condom on and it's with me and can wear it." A female condom is also called an internal condom and is inserted into the vagina. Other women take the position that if their partner wants to have sex, they will need to accept that they are going to use a condom, and as some say, no glove, no love. Meaning if they won't agree to have sex unless a condom is used. I like that, no glove and no love. Let's talk about risk reduction. Some sexual interactions with a partner who has an infection can pose some risk for transmission. So even though someone has had or cured or treated an STI, doesn't mean they cannot become reinfected with the same or a different STI. Wow. Most STIs do not have symptoms to indicate the infection. Women particularly may not know they carry it and can transmit it and an infection until it is diagnosed in a clinic or doctor's office. So when there are physical signs of infection, lesions, blisters, anything in the vaginal canal that may be visible, some women may not recognize a change in odor or slight discharge. It is necessary to ask for STI screening when you have your annual Pap test. Since most annual gynecological exams will not automatically include a full STI screening. So ask for what you need. So avoiding behaviors can transmit infections with partners who are infected. That is one of the most effective methods to reduce the risk, avoiding behaviors that can transmit infections. Okay. Remember that anyone who has had unprotected sex can potentially be infected and not know it. So negative results on a complete STI screening and no unprotected sexual intercourse of any kind, since the test is for a period of 3 months, and it provides good assurance of being STI free. So during this time, So first, during the 3-month window period when an infection might be present, but not revealed by medical screening, okay? It is important to reduce potential risks during this time. So the use of latex condoms or engaged in outer course is a behavior that do not pose potential risk of infection until a negative STI status is assured. So aside from abstinence, there are several ways to reduce the risk of contracting an STI from vaginal, anal, and oral sex, so other forms of genital contact that may result in infection transmission. So that's doing things like using latex condoms or dental dams when you have intercourse, use latex gloves when touching fluids or infected areas, limit the number of partners who have had more partners than you are comfortable with, avoid vaginal douching unless recommended by the healthcare provider, which may increase the risk of some bacterial infections or vaginal irritation. Get routine medical checkups, including the STI screenings. You also want to avoid contact with blood, semen, and vaginal fluid. Also, when using sexual enhancement products, avoid sharing the same product sex toy with another person. If you use to share a sex toy or vibrator with a partner, consider putting a condom over it before using it with a partner. It's also wise to wash sex toys with soap and water after use and store them in a clean, dry place. And we would say not soap and water, ladies. We could say our cleansing mist, which is a spray, or our cleansing foam. You do not want to use soap on your bedroom toys or accessories. They do compromise the silicone that it's made of. All right, correct condom use. Now, this is key. Consistent and correct use of latex condoms is a very effective way to reduce risk of STIs and pregnancy. Okay, so correct condom use is not as simple as opening the package and sticking it on. So practice handing them prior to interacting with a partner can help one feel confident and more comfortable to assure correct use. So getting latex or polyurethane condoms is the first step. Latex condoms provide very effective protection. However, lambskin condoms, for people who may be allergic to latex or just have this as a preference, lambskin condoms do not protect against STIs. Again, only the latex condoms do. However, lambskin condoms do not protect against STIs. Lubricated and non-lubricated condoms are available at many drugs and grocery stores, as well as clinics and sex toy and erotic bookstores. Now, there's novelty condoms that do not provide effective protection against STIs. I don't know what those necessarily look like, but you know, if it looks like a toy or looks like it's something that doesn't do the job, believe that. You want to make sure you get a good latex condom that is going to be good protection. Okay. Wow, lambskin condoms. All right, so negotiating condom use prior to initiating the sexual interactions is good use for the condoms. You want to make sure you check the expiration date on the condom package. The package should be spongy to the touch and hold air to assure the latex is intact. Sorry. Then you also want to put the condom on before any genital contact. So don't start having sex and then go, oh, we do need to put it on. You want to do all that first because pre-ejaculate can be infectious. Now, many prefer to place a small amount of water-based lubricant inside the tip of the condom before it is rolled on or for added comfort. Never use oil-based lubricants with latex products. Roll the condom down the shaft of the erect penis. And if the condom was placed on upside down, do not turn it over and roll it down. It may have some fluid on the outside and would not provide protection then. So you just use a fresh condom. You want to leave the room at the tip. You want to leave room at the tip of the condom for the ejaculate. So many condoms have a special reservoir or tip designed for this purpose. There should be at least a half an inch at the end of the condom. Now, application without the room at the tip increases the likelihood of breakage. The ejaculation can be very helpful and cause breakage if there isn't space for it to go in. Unroll the condom all the way down the base of the penis. You want to make sure that condoms that they come in different sizes, and then the fit is important. Check the condom frequently during sexual activity to be sure it is in the proper place. Nothing like going through full intercourse and engaging and enjoying yourself and you realize, oh, condom popped off 2 seconds ago. So you want to make sure it is in place, okay? So if one partner is menstruating, she should remove the condom that was used vaginally and dispose of it, okay? After removal, the condom is in a knot. You want to throw it in the trash and never dispose of condoms in the toilet. All right, protecting my partners from contracting a STI from me. So in cases where someone is infected with an incurable STI, concern about disclosing this information to a potential partner and reducing risk of infection for partners become very important. So disclosing that you have an incurable STI to a partner requires trust and emotional vulnerability. Now, talking about your situation at a time when you are not erotically engaged or on the verge of sexual interactions is a good idea, right? Dropping this information at a time when you or your partner is aroused can make avoiding risky behaviors more difficult. All right, people with HIV infection usually develops AIDS, and so far there are no cures for the vaccine for HIV or AIDS. Now, often people can live HIV positive as a healthy individual for a decade or more. Now, later though, most people begin to show serious illness. Now, when an HIV plus person is diagnosed with one of the opportunistic diseases associated with her T cells being above or below a certain number, he or she is diagnosed with AIDS. Some drug treatments are greatly delayed the onset of AIDS and in some HIV positive. The drug regimens can be very rigorous and expensive. Ending drug therapy after beginning, it can be very detrimental to HIV and the patient's health status. All right. So what do we have for the interactive quiz? Information about STIs. So it says, please type your response in the text boxes, save your response, and then submit on the last page. When you have completed the assignment, once you have submitted your response, Dr. Herbenick or Dr. Reese will log on and grade your assignment so that you can proceed to the next unit. All right, let's see, what part are we on? Okay, it says visit the CDC's website and look up information about 2 sexually transmissible infections. Identify which STIs you have looked up the information about, and then list their names here. Okay. So it's 5 different activities. The next one is thoughts on the CDC fact sheet. What are your thoughts of the fact sheet? Did they do a good job of explaining? And here we go. The next one, addition to the CDC's fact sheet. What additional information should be helpful to the CDC fact sheet for these 2 STIs, if there's anything, the ones you chose? They want information about Planned Parenthood, and the website is designed for teenagers and their parents. What do you think about the information presented in this website? What ages does seem targeted towards? Do you even know? Do you think these types of resources might recommend to parents or older children or teenagers? Why or why not? All right, so we're gonna go ahead to the quiz. All right, so we have question 1. The viral STI symptoms from HPV, herpes, and HIV can be treated but not cured. True or false? I'll give you a chance. That's true. It can be cured. The viral STI symptom from HPV, herpes, and HIV can be treated but not cured. That's the key thing. Not cured, but can be treated. All right, 2. I'm getting a little tired, but I'm almost done. Once an individual has had an STI treated or cured, they cannot become reinfected with the same STI. Is that true or false? That is false, man. You want to make sure that you know that it is possible for them to be reinfected with the same STI. The whole thing, you want to make sure that they know what things not to do so that they could possibly prevent that. But usually your medical professionals will help them with that. 3, it is safe to use latex condoms with oil-based lubricants. True or false? It is not safe to use the latex condoms with oil-based lubricants. That's why Pure Romance has water-based and silicone-based, but silicone does not work well with the latex, and we let our clients know that. Water-based lubricant for the latex condoms. All right, on number 4, we have STIs are diagnosed in a variety of ways, but they rarely require lab cultures or blood tests. That is 4. Is that true or is that false? It is false. STIs are not diagnosed in a variety of ways, but rarely require lab cultures or blood tests. They require lab cultures and blood tests. So you see the trickery right there? It says STIs are diagnosed in a variety of ways, but they rarely require lab cultures. That is false. We need those lab cultures. Okay, number 5, chlamydia is an example of blank STI, which can be cured, whereas herpes is an example of what kind of bacteria, which cannot be cured. This is going to be the first one, bacterial and viral. So chlamydia is an example of bacterial STI, which can be cured, whereas herpes is an example of a viral STI, which can be treated but not cured. So first one, bacterial and viral. So, okay, we are on 6. So Betty has cervical cancer. It could be related to the blank infection she got back in college. Is it hepatitis A? Is it human papillomavirus? Is it syphilis, or is it chlamydia? So for 6, yay, human papillomavirus, HPV. Okay. Let's go to 7. Which 2 sexually transmissible infections are spread through skin to skin contact? Would it be HIV and hepatitis B? Would it be herpes and gonorrhea? Would it be HPV and chlamydia? Or would it be HPV and herpes? Which are the 2 sexually transmissible infections which would spread through the skin, spread through skin to skin contact? All right, we're gonna go with HPV and herpes. Okay. 8. Which of the following behaviors can reduce the risk of STI transmission? We're going to go with the last one. All of the above can reduce the risk of STI transmission. That is all of the above. So using latex condoms or dental dams when you have intercourse, limit your number of sexual partners, avoid contact with blood, semen, and vaginal fluid, and all of the above can reduce the risk of STI transmission. So 9, if you have contracted an STI, what can be done? Do you get medical screening and treatment immediately? Do you encourage your sexual partner to get tested and treatment? Do you abstain from sexual interactions that are risky while you're infectious? All of the above are good things to keep in mind after you contract an STI. Okay. All of the above. Okay. 10. All right, HIV directly attacks the immune system by destroying what? The pathogenic cells, the CD4 cells, red blood cells, or platelets. Okay, 10, we're gonna go with CD4 cells. That is the section option, CD4. So 11, which of the following is a cure for genital herpes? Is it freezing the herpes lesions? Is it applying acyclovir ointment 3 times a day? Is it penicillin or other antibiotics for 2 weeks? She was, let's see. Which of the following is the cure for genital herpes? Okay. So right, 11. There is no cure for genital herpes. Okay. 12, which of the following is not considered to be an effective prevention strategy for reducing your risk of STIs? What is not considered to be an effective prevention? 12, is it avoiding the use of alcohol or drugs, using birth control pills effectively, avoiding high-risk sexual behaviors, using latex condom for all forms of genital and sexual activity? 12 is using birth control pills effectively. Which of the following is not considered to be an effective prevention? Right. Birth control pills is not going to help you with STIs. Okay. So 13, if you think you may have an STI, which of the following should you do? What are you going to tell your people to do? Get medical screenings immediately, tell your partner, encourage your partner to get tested and treatment, or all the above? Let's go with all the above. Get medical screening and treatment immediately. Tell your sexual partner if they might have been exposed. Encourage your partners to get testing and treatment. And so we are going with, I forgot already, all of the above, right? So 14, which of the following STIs can be treated but not cured? Syphilis, gonorrhea, herpes, or chlamydia? Herpes. All right, we'll go with herpes. And last question, which of the following are reasons for engaging in risky sexual behavior? Is it perceived low risk of infection, negative attitudes towards the condom, myth of personal invulnerability, or all the above? These are reasons for engaging in that risky behavior. I ain't worried about nothing. Who cares? A lot of people do oral sex without condoms with people they are not in long-term relationships with, or even have any testing or communication done. So in that case, there's just people who do that, do oral favors for each other without that backup. And it is because they have a low risk, they have a perceived low risk of infection. They have negative attitudes towards using some kind of condoms. Maybe they don't want condoms in their mouth and they're doing oral favors. Myth of personal invulnerability. They're going to lose out on that sexual experience if they are being super safe. So risky sexual behavior. We're going to go ahead and submit those answers. 1 is correct. 2 is correct. 3 is correct. 4 is correct. 5 is correct. 6 is correct. 7 correct. 8 correct. 9 correct. 10 correct. 11 correct. 12 correct. 13 correct. 14 correct, and 15 correct. You can get 15 out of 15. I'm glad you all stayed on with me. I will not continue into the next unit, the unit 11. I'll create a separate video. I hope you enjoyed. Please go back, fill in the activities that were for this lesson. There was an interactive activity on here, and they have an interactive activity with each course. So you want to go ahead and do those things to get credit for completion of this course, okay? I'll be working on uploading this file so that you can have access as soon as possible. Let's get this class finished before the holiday season comes in, or before the new year rolls in. I know that we can do it, and I hope you enjoy. You have a great evening.